Infarction أو ما نسميه الجلطة is an area of ischemic necrosis. So it's an area of irreversible cell death happens through the necrosis and caused by ischemia. So the cause is occlusion of the vascular supply to the affected tissue, resulting in infarction. So the type or the example of the infarct will depend on the blood vessel that is occluded. So if the occlusion happens in the coronary arteries that give supply to the heart, this will result in myocardial infarction, الجلطة القلبية. If the occlusion affected the cerebral arteries in the arterial circulation of the brain, this will result in cerebral infarction, جلطة دماغية. If it happens in the pulmonary circulation supplying the lung, this will result in pulmonary infarction. If it happens in the blood vessels that supply the bowel, this will result in bowel infarction. And also if it happens in the blood vessels that give the supply into the distal extremities, this will result in ischemic necrosis of distal extremities, which we call it gangrene. And this is usually common in the diabetic population. So the name of the infarction depends on the blood vessel that is occluded and the tissue that undergoes ischemic necrosis. Infarction is caused by complete obstruction of the blood supply to a tissue or organ, and this is most commonly due to arterial thrombosis or arterial embolism. Other causes of infarction that will result in total obstruction of a blood supply may include vasospasm, so narrowing of the vascular lumen resulting in complete obstruction of the blood supply to a tissue or organ. Also the expansion of atheroma or the atherosclerotic plaque في حالات تصلب الشرايين نتيجة وجود hemorrhage داخل البلاك نفسها. فلو حكينا إنه the plaque or the atheroma is obstructing 50% of the vascular lumen and then suddenly صار عنا intra-plaque hemorrhage, صار نزيف داخل البلاك نفسها وعمل 100% obstruction due to the expansion of the atheroma, this will result in complete obstruction of the blood supply. Also, if there is a tumor or a mass compressing the blood vessel from the outside, so the extrinsic compression of a vessel from the outside by a tumor, for example, may result in complete cut of the blood supply, and this will result in tissue infarction. Other uncommon causes of tissue infarction include vessel twisting, الالتواء. And examples on this, what happens in testicular torsion or the bowel volvulus. في البول volvulus اللي بنسميه الانفتال، جزء من الأمعاء بيلتف حول نفسه بيؤدي ل complete obstruction of the blood supply to the tissue or organ. Same things happen in testicular torsion or testicular twisting, الالتواء. Other uncommon causes for tissue infarction include trauma that will result in vascular rupture, for example, so complete loss of the blood supply, or entrapment of the blood vessel within the hernia sac. If the patient have hernia اللي هو الفتق وانحصر في داخله أحد الأوعية الدموية وصار عنده complete obstruction of the blood supply, this will result in infarction. Let's now talk about venous thrombosis. Venous thrombosis can cause infarction actually, but the most common outcome for venous thrombosis is simply the congestion, because usually there are bypass channels that will rapidly open and provide the sufficient outflow and restore the arterial inflow. So متى الفينيوس thrombosis ممكن إنها تؤدي فعلا لإنفاركشن؟ Infarctions that are caused by venous thrombosis usually occur in organs that have only a single efferent vein, like the testis or the ovary. So once this vein is obstructed, there are no collateral or bypass channels, and that will result in infarction. The morphology of the infarcts is classified according to their color, which reflects the amount of hemorrhage. So infarcts are classified either to be red, hemorrhagic, or white anemic, depending on the amount of hemorrhage. And also, they are classified according to the presence or absence of microbial infections. So, they are either septic if they have microbial infection, or bland if there is no microbial infection. In most tissues, the main histologic finding associated with infarcts is the presence of ischemic coagulative necrosis. This is usually followed by an inflammatory response starting at the margins of the infarct within few hours, and this inflammatory response becomes well developed within 1 to 2 days. And eventually, the inflammation will be followed by repair beginning at the preserved margins. Ultimately, most infarcts will be replaced by a scar. The brain is the exception. Remember in the lectures of cell injury, ischemic tissue injury to the central nervous system will result in liquefactive necrosis, not in coagulative necrosis. This figure shows the gross or the macroscopic appearance of a red infarct in the lung. This infarct is like wedge-shaped, hemorrhagic, red to brown in color, and always remember the lung has dual blood supply. This figure shows the gross or the macroscopic appearance of a white infarct in the spleen. As you can appreciate, we have a wedge-shaped pale area that is deprivated from blood, and that's why we call it a white infarct. This figure shows an old kidney infarct that is replaced by a large fibrotic scar. Remember, we said that after coagulative necrosis, inflammatory cells will be coming within hours, will established within few days, and then the entire process will be replaced or the infarct will be replaced by a scar.